where you're sitting right now in West Springfield, along with Sister Caritas Cancer Center of Mercy Medical Center. So it is an ongoing lecture series, and we're so happy that you're here tonight, and we'd love to have people join us and come to the house in person. This is an ongoing lecture series, so every month basically, or every other month, there's a wonderful topic with a wonderful presenter. So please check on Facebook. There's a Facebook site for the Cancer House of Hope. There's a website, the Center for Human Development website. If you look under Adult Services, you'll find the Cancer House of Hope. And if you look under Lecture Series, it will tell you what the next upcoming lecture will be, who will be presenting, and what the topic would be for that lecture. So we hope that you'll enjoy tonight's session, of course. We hope you'll come back for another session at some time. And we also hope that you'll return and just visit the house in general if you've not been here before. Something to keep in mind is that the Cancer House of Hope is absolutely free of charge. What free lunches are there in this world anymore? But this is a free lunch if you want to say it that way. Cancer House of Hope is free. What does that mean? It's free to someone coming that unfortunately is dealing with cancer. It's free to their family, their friends, and their caregivers. That means absolutely free. That means there's no insurance requirements, there's no doctor referrals needed, there's nothing, and there's no charge for anything. And there are wigs available for those that need wigs, and there's breast prosthetics that are available as well as a lending library and a lot of other services. You're actually sitting in what usually is the yoga studio, which may look a little strange for a presentation, but this is where yoga classes are taught. And again, anything, relaxation, meditation, support groups are all here and available, again, to those with cancer, their friends, their families, and their caregivers. So we hope that if you haven't visited before, you'll come. And also there's other events such as the Luminaria event that's coming up. That's a beautiful event coming up December 7th? Monday in Westfield. And that's a wonderful annual event. There's beautiful luminaries out on usually a beautiful cold night, and hopefully a dry one. Please look at other events that are held as well, and please consider attending because there are some wonderful events. But without further ado, I want to welcome you to tonight's lecture series session, which we've titled, How Can I Reduce My Risk of Cancer and Cancer Reoccurrence? Tonight's presenter is Dr. Timothy Johnson. Dr. Johnson studied chemistry from Williams College, went on to medical school at the University of Connecticut Health Center. He's published original research regarding treatments received from the American Society of Clinical Oncology. He received the Young Investigator Award. And he's returned to the East Coast in 2004, settling in Massachusetts, and he is board certified in medical oncology and internal medicine. And without further ado, I'd like to present Dr. Johnson.
Well, thanks for the introduction, Troy, and I appreciate everyone coming out on a dark and rainy night. Hopefully we'll cover some ground tonight. The title of my talk is How Can I Reduce My Risk of Cancer and Cancer Recurrence? And I want to say from the outset that this advice is fairly simple. A lot of what we've all heard about from our doctors regarding the prevention of heart disease that's started in the 1960s, 1970s, also applies to reduce the risk of cancer and cancer recurrence. So a lot of those principles are going to be the same and they're going to be familiar. Certainly what we have in our society is media which can spew out all sorts of recommendations for avoiding cancer and curing cancer that are false or misleading. And I'm going to try to sort out some of the major media buzz that's happened in the last 5 to 10 years also. So cancer is the leading cause of death in the United States for people under age 85. About 500,000 cancers are diagnosed per year in the United States. 560,000 deaths due to cancer, and lung cancer is the major killer. 160,000 deaths due to lung cancer every year. And what people may not know is that many cancers are preventable. About 60% of cancers are preventable. 560,000 deaths from cancer, 310,000 deaths are preventable. So 170,000 preventable deaths from smoking, which causes 30% of cancers. 90,000 preventable deaths from overweight and obesity. 30,000 from a poor diet, lack of exercise, 18,000 from a lack of screening, 2,000 from sun overexposure. So, and I don't want to assign blame to people who get cancer. That's the last thing I want to do. I just want to spread education throughout the community that we can all be aware of to try to prevent future cancer or any types of cancers. So the first thing, don't smoke. That's simple to say. Sometimes it's hard to stop smoking, but smoking causes 30% of cancers. Smoking can not only increase the risk of lung cancer, which it does by 20 times, but it can also increase other cancers: oral cancer, throat cancer, esophageal cancer, stomach cancer, colon cancer, kidney cancer, bladder cancer, and leukemia. These are by a smaller amount, by 10 to 25%, but it's certainly not only lung cancer that's tied to smoking. And this is a very telling slide about our country. Back in the 1930 or so, very few people smoked in this country, and the rate of lung cancer was very low. Lung cancer was a relatively uncommon cancer back then. And then the smoking rate went up during World War II. It peaked around 43% of the United States population. That's the yellow line here. And then when the Surgeon General warnings came out in the 1960s, the smoking rate gradually declined in this country from 43% down to about 20%. And then you can see the death rate from lung cancer lags about 15 to 20 years behind the yellow curve, but it peaked in the 1980s and then started to decline just as the smoking was starting to decline as well. And that's good news. We know that smoking causes lung cancer. People have gotten the message. The smoking rates seem to decrease, from the 1960s. But the bad news is that since this curve, since 2005, there's been no further drop-off in the quitting smoking. So but still about 20% of the adult population smokes in this country. And so the death rate from lung cancer, we expect, is going to level out. So stopping smoking is a big deal. There's an immediate drop in the risk of lung cancer seen on the red line when you stop smoking. So there's a benefit at 5 years, it comes down, 10 years, and about 15 years it reaches a minimal level, but it's still about twice the level of the general population. Lung cancer screening is important. It's a recent data showing that getting a CAT scan once a year can detect early lung cancer. So anyone who's even recently quit smoking should probably also think about screening with chest CAT scans. Secondhand smoke is another cause of cancer. I won't get into that too much. Smoking cessation, there's a great telephone resource, telephone counseling, 1-800-QUIT-NOW. From the pharmacy, there's nicotine replacement patches, gum, lozenges. From your primary care doctors, you can get prescriptions, medications, Chantix and Wellbutrin. What else can we do? Keep a healthy weight. So no smoking, keep a healthy weight. Excess weight causes 15% of cancers in the United States. 65% of U.S. adults are overweight. Among that group, 30% are obese. And it's important to note that in the last 25 years, there's been a gradual slight decrease in the rate of cancer in the country, and there's been a gradual improvement in the mortality from cancer. But experts think that in the next 25 years, the obesity epidemic is going to reverse those gains in cancer, and the death rate from cancer is going to go up. So to pay attention to our own weights, a body mass index is an important starting point. You can search Google for BMI, type in your height and weight. 19 to 25 is normal. They have a chart online for you too. 25 to 30 is overweight, and over 30 is obese. So that's a helpful tool. Probably your primary care doctor should be doing that for you as well. Obesity causes increase in most cancers. Esophageal cancer, the most pronounced, increase in 50%. colon cancer 25 to 50%, kidney cancer 25%, and breast cancer 15%. How does obesity increase the risk of cancer? Well, for some cancers, having a higher weight can change the hormone levels, particularly breast cancer and prostate cancer can be increased due to a change in the hormones in the body. And also increased weight is thought to increase insulin levels and general inflammation in the body, and that can increase the risk of breast cancer and colon cancer. And we know that exercise can decrease those hormone levels and decrease the insulin levels and provide protection against cancer. What to do if overweight? Exercise 30 minutes 3 times a week. And it's important to work up a light sweat, get your heart rate up a little bit. More vigorous exercise is better than sort of slow-paced exercise. So eat a healthier diet, avoid overeating. Some of the differences in cancer rates between the United States and Canada or France have to do with the size and proportions of meals that we eat. In the United States, we typically eat large portion meals. Avoid fast food restaurants, avoid fried foods, eat more fruits and vegetables, and target a BMI less than 25. Just say no. This is probably the most evil food out there. Because it's fried, processed, and exercise decreases the risk of breast cancer and colon cancer, and probably most cancers to a smaller degree. The lack of exercise causes 5% of cancer deaths. And the important point I want to make is that exercise is important even for people with a normal BMI or normal weight. It's been shown to make a difference. If people are sedentary and they don't exercise but have a normal weight, they're still at a higher risk of cancer. Maintain a healthy diet and exercise. Diets high in red meat can increase the risk of colon cancer and prostate cancer. And the recent WHO reports and proclamations have shown that even particularly processed meats like bacon are particular offenders in both colon cancer and prostate cancer. A large analysis of several clinical trials in diet and colon cancer published in 2012 showed that a prudent diet high in fruits and vegetables versus a Western diet high in red meats and potatoes, the prudent diet lowered the risk of colon cancer by 30%, something a lot of us already know from the media. In diet, try to eat a 50-50 balance of red meat and poultry and fish. It's still okay to eat red meat, but keep a balanced diet. Maybe do 1 meal a week with vegetarian, 3 with poultry or fish, and 3 with red meats to find a healthy balance. And pork is a red meat, so that's important to keep in mind too. More fruits and vegetables are better for your health, helps maintain a healthy weight, prevents heart attacks and strokes, and reduces cancer risks. Like I said, just the same principles apply to cancer prevention. And what types of diet? Well, the most dramatic finding from all these studies on diet and nutrition was an observational study done in Sweden with 82,000 people. They were sent questionnaires over a long period of time, over several years, and asking very specific questions about their diet, what they eat. And they found that a high folate diet helps prevent cancer versus a low folate diet. The high folate diet lowered pancreatic cancer risk by 51% and esophageal cancer by 34%. And what it's rich in folates: rice, breakfast cereals, beans, spinach, cauliflower, broccoli, romaine lettuce are all rich in folates. And I want to also point out that taking folic acid pills, there have been studies on that looking at all sorts of cancers, and folate pills over the counter do not decrease the risk of cancer, but seemingly the diet that are high in folate does. So it's not exactly the folate necessarily, but maybe some other things that go along with this diet. And then we all heard about tomatoes and lycopene for prostate cancer a couple of years ago. and the FDA recently found limited evidence of benefit for lycopene-rich diets in preventing prostate cancer. That means they don't believe it. Supplements, calcium and vitamin D, maybe, but it needs more research. There was some evidence that taking calcium cut down the risk of polyps in the colon, but that, again, has been questioned recently. There's some concern about taking too much calcium, over 2,000 milligrams a day, can actually increase the risk of prostate cancer. So you have to be careful. You don't want to just load up on calcium and vitamin D because there can be some harmful effects too. But for the most sound recommendation is for postmenopausal women to have calcium and vitamin D replacement in reasonable amounts. Your primary care doctor may be checking your vitamin D level and giving recommendations to replace that. That's fine. Aspirin, it's been hard to show a benefit of aspirin in preventing cancer. There is some data with taking aspirin after a diagnosis of breast cancer decreases the risk, but there are ongoing trials trying to verify that. But it's not for everyone to prevent cancer, so I wouldn't take aspirin without talking to your primary care doctor. It can certainly increase the risk of bleeding. And another list of things that you've heard in the media over the last 10 to 15 years: vitamin C, vitamin E, selenium, beta-carotene for lung cancer reduction, multivitamin. There's no evidence for decreasing cancer risk. They've all been tested in large trials with tens of thousands of people, and there's been no benefit for decreasing the risk of cancer. Alcohol. This is one point that is a divergence between what's good for heart health and what's good for cancer health. Drinking alcohol, 1 to 2 glasses of wine a day, can decrease your risk of heart attack, but, go ahead. Alcohol can also increase the risk of cancer by a slight amount. Oral cancer, esophageal cancer, and breast cancer. So my advice is to drink alcohol no more than 3 days a week and give your body a rest on the other 4 days. Or drink less than that would be fine too. Chemoprevention, there's a lot of research into medicines which can prevent cancer. If you're a woman over 50 with a mother or sister with a history of breast cancer, you can talk to your primary care doctor about tamoxifen or Evista therapy to reduce breast cancer risk. It's 1 pill a day for 5 years, which can cut the risk of breast cancer by 1/2. For example, your lifetime risk, if it's high, it could be around 25%. That would be cut down to 12.5%. There are other benefits to taking these pills, such as bone strengthening, but there are side effects such as hot flashes. 50% of people can get hot flashes. Statins, again, another real buzz, probably 3 or 4 years ago. Again, a large analysis of 26 clinical trials found no benefit from cholesterol-lowering statin drugs in preventing cancer. What else can we do? Follow cancer screening advice. Mammograms save 12,000 lives a year in the United States. Pap smears save 4,000 lives a year. Colonoscopy and PSA and rectal exam is unknown. There's still ongoing research and debate about how many lives are saved with those interventions. Deaths from breast cancer have decreased every year since 1990. Half the lives are saved by better treatments. Half the lives are saved by more women getting screening mammograms. Mammograms can catch breast cancer earlier. A woman who gets regular screening has an over 80% chance of cure because the cancer is smaller when found. A woman who does not get screening has only a 60% chance of cure because the cancer is more advanced. There's been a lot of controversy over the last few years about mammograms between age 40 and 49. But it's a sobering fact that without screening, 6,400 women from age 40 to 49 will die from breast cancer each year. With screening, 1,000 of those lives would be saved. But I want to prevent a balanced view, and there are dangers of screening rigorously in the population between 40 and 49 also. There's false positives can be found, leading to unnecessary biopsies, unnecessary anxiety, and sometimes only small, what they call DCIS tumors are found, which may not have grown into cancer anyway. So there's a downside to have rigorous mammographic screening also. A colonoscopy can catch colon cancer earlier. If it's caught early as stage 1 cancer, it's a 95% chance of cure. If more advanced when found, maybe a 50 to 70% chance of cure, and you may need chemotherapy to improve the chance of cure. Colonoscopy may find a polyp, which is precancerous. Removing the polyp can decrease the risk of the cancer developing later by 50%. At age 50, 25% of people have polyps on their colonoscopy. At age 70, 40% have polyps. Recent guidelines from the ACS for cancer screening include a mammogram starting at age 45. That was a recent change, and then yearly to age 55, and then every 2 years. A pap smear starting at age 21, and every 1 to 3 years until age 65. Colonoscopy age 50, 60, and 70. And as I mentioned, chest CTs yearly for smokers between age 55 to 70, and for people who recently stopped smoking. What else can we do to avoid overexposure to the sun? 59,000 cases of melanoma every year, 13% or 8,000 are fatal. You report any usual skin lesion to your primary care doctor. Have a spouse and friend examine your back. Recommendations for sun protection: limit the time in the sun, especially between 10 a.m. and 3 p.m. Wear protective clothes, hats, sunglasses, longer sleeves. Use sunscreen SPF 30, especially reapply after swimming. And then just to go a few specific clinical trials on recurrence of cancer. And again, the same principles from preventing cancer apply to preventing recurrence of cancer. There's a women's interventional nutritional study, 2,400 women with stage 1 to 3 breast cancer, a low-fat diet versus a regular diet, which is whatever they wanted to eat. The low-fat group lost 6 pounds. The regular group had no weight loss. The low-fat group had a 24% decrease in recurrence, so a very significant. It's just as effective as hormonal therapy. Lifestyle recurrence, interventional trial in prostate cancer, lifestyle trial. 93 men with early prostate cancer. They underwent a sort of a multi-modality interventional program. Less than 10% of calories from fat, a plant-heavy diet, regular exercise, stress management counseling, which is something that is beyond the scope of my talk. And at 2 years, only 5% of the interventional group, the ones that got that change in diet, the exercise, the stress management, only 5% needed some form of treatment versus 27% in the group that had none of the interventions. So again, a dramatic finding. An interventional trial with 1,455 men with early prostate cancer, walking at a brisk pace 3 hours per week versus walking at a leisurely pace 3 hours a week. The walking briskly lowered the chance of recurrence of the prostate cancer by 57%. So another dramatic effect of exercise and recurrence. And I would also say that there are hormone-sensitive cancers, breast cancer and prostate cancer, and they're probably more modulated by diet and exercise, lowering the hormonal levels and preventing recurrence. But I believe more research is going on about other cancers as well in terms of recurrence, and the findings are similar, that diet and exercise can decrease the risk of other cancers, not just breast and prostate cancer. Aspirin and breast cancer recurrence, there's an observational trial, Nurses' Health Study, 121,000 nurses, which is a huge study. The questionnaire about aspirin use, women who took aspirin 81 milligrams more than 2.5 days a week versus women who took no aspirin. The aspirin decreased the risk of recurrence by 50%. But again, like I said, this is not a prospective trial where we start the trial, we randomize women into aspirin versus no aspirin, and then watch very closely. That's ongoing now, and we don't have the answers, but it's something that may come out in the future. But there are many other studies that show that aspirin do not show that aspirin reduces the risk of breast cancer, and that aspirin can cause bleeding. So aspirin has not quite made it to our standard guidelines yet in terms of chemo prevention of breast cancer recurrence. So in summary, what can you do to reduce the risk of cancer and cancer recurrence? Don't smoke or quit smoking. Maintain a healthy weight. Exercise briskly and regularly. Eat a healthy diet with folate-rich foods. Drink alcohol only 3 days a week at most. Follow cancer screening guidelines. And avoid too much sun would be the basic, simple principles of cancer prevention.
So we'd like to open it up to questions.